Vocal cord dysfunction is a rare condition that can easily be mistaken for asthma. Have you been diagnosed with asthma? If so, it may be vocal cord dysfunction. The National Jewish Center for Immunity and Respiratory Medicine website, copyrighted 2008, states that in 1983, doctors at National Jewish Health described a condition that may be confused with asthma. This condition is called vocal cord dysfunction. To understand the condition, VCD, we must first define what causes it and what symptoms it possesses. Then we will look at the procedure used to diagnose it, treatment for it, and finally we will look at some statistics in reference to VCD. Vocal cord dysfunction is caused by paradoxical vocal cord movement with inappropriate adduction of the vocal cords during inspiration, leading to airflow obstruction that in turn leads to labored breathing with inspiratory high-pitched stridor, chest tightness, and shortness of breath. Recent case reports have shown other causes of vocal cord dysfunction, such as inlet path of heterotopic gastric mucosa in the upper esophagus and exposure to agents such as glutaraldehyde, chlorine, and even eucalyptus. Some symptoms of VCD include wheezing, coughing, and dyspnea, throat tightness, vocal cord voice change, and difficulty getting air in more than out. The initial diagnosis of VCD in patients is made by laryngoscopic observation. This laryngoscopy procedure consists of an examination that allows your doctor to look at the back of your throat voice box and your vocal cords with a fiber optic scope. There are two phenotypes of VCD, which are exercise-induced or EI-VCD and spontaneous occurring VCD or SVCD, with VCD frequently being misdiagnosed as asthma, anaphylaxis, or angioedema, and is often treated with high-dose inhaled or systemic corticosteroids, bronchodilators, multiple emergency department visits, hospitalizations, and in some cases, tracheotomies and intubation. To manage VCD, doctors educate the patients on VCD as well as provide speech therapy to decrease the tension of the extrinsic laryngeal muscle. In a medical review, investigators identified 49 patients ages 8 to 25 years of age diagnosed as having VCD from 1989 to 2002. Of the 49 patients, 41 had been treated previously for asthma, but that diagnosis was confirmed as a comorbidity in only 12 patients. Of the 49 patients identified, 29 had EI-VCD only, 20 had SVCD, and 4 of whom also had EI-VCD. The median age for diagnosis for exclusive EI-VCD was 14.9 years versus 13.5 years with those with SVCD. Statistics show there were more female than male patients with a ratio of 1.6 to 1 for EI-VCD and 2.2 to 1 for SVCD groups. By defining what VCD is and its causes and methods used for diagnosis, it helps separate VCD from asthma. We can now understand why VCD is easily mistaken for asthma. Today's topic was have you been diagnosed with asthma? If so, it may just be vocal cord dysfunction. If you or someone you know is experiencing symptoms that resemble those of asthma, you should request to be tested for VCD. Just because it looks like asthma doesn't necessarily mean that it is.